Hello and welcome to the Blue Goat Cyber monthly webinar. I'm your co-host Christian Espinosa along with Trevor, and we're going to be guiding you through when cybersecurity should be considered for MedTech startups. There's a common misconception, and we deal with a lot of prospects and clients that often start too late or don't quite know the answer to this question. So we thought it'd be a good topic for a webinar. As we move along through the webinar, if you have any questions, feel free to drop them in the chat, and also let us know where you're tuning in from. I'm coming from Tempe, Arizona today, and Trevor is slacking and took some time off on vacation in Aspen for his birthday.
A little bit of time off, a little bit of time on.
Time off and time on. He's skiing down mountains and doing dangerous things as usual. All right, so go ahead and get started here. So one of the challenges we face is cybersecurity typically shows up too late for medtech innovators, and this causes a lot of challenges and a lot of frustration, really. It typically results in launch delays because if you wait to the very end, let's say 60 days before a pre-market submission, you're probably going to have cybersecurity issues come up if you hire a firm to do penetration testing, as example, and it's going to take you longer than those 60 days to remediate and do the rework, which will delay your time to market and delay your clearance. In addition to the technical items that may come up, we typically find a lot of gaps in the documentation. The FDA, MDR, they require specific types of documentation for traceability, for risk assessments, and there are a lot of requirements for each of those deliverables that are often skipped or misunderstood. Even things like a software bill of materials, we've had clients try to submit them in Excel spreadsheets before, which is not the proper format. And that, of course, delays the submission or results in a additional information notification from the FDA. Also, if cybersecurity shows up too late, it does result in more difficult regulatory submissions like we've been talking about. Plus, the customers your clients, ultimately, if you're the medtech innovator, may start asking questions. The whole concept is we're supposed to have cybersecurity built in to the product from design until disposal. And actually, if we go one step before design, it should be part of the requirements that are then designed into the product. And something that's come up quite a bit recently is many investors have been burned because the medtech innovator they invested in did not consider cybersecurity, and then there was a delay to market. They needed more investment money. So a lot of investors are starting to look now to see if you've got cybersecurity part of your roadmap, along with things like intellectual property and insurance and market fit and cost reimbursement strategy.
I think one thing that is really important tying into what you were saying about the investors is that cybersecurity is currently one of the #1 reasons that medical devices are kicked back by the FDA. So it's becoming a very significant risk when you're getting ready for a regulatory submission and the regulatory process to not have cybersecurity covered. You're running a pretty significant chance that the regulators are going to come back with significant concerns asking for these significant reworks.
Definitely. I don't know if it is one of the #1. I think it actually is the #1.
It very well could be. It is. It seems to be the top of everyone's mind, especially the FDA's right now.
Mm-hmm.
All right. Well, we're talking about what it looks like when cybersecurity happens too late, but what are these ideal times? What is a good time for cybersecurity? And as you were saying, we want to see it from design to disposal and even before there. But when we're looking at product design, it's important that we think about how to wrap cybersecurity into it. One thing that we talk about all the time that is really important to remember is that cybersecurity is not just a point in time or a phase. It's a thread that is going to wrap around the entire product throughout the entire life cycle. So we'll take another similar example. Let's say you're going through biocompatibility, usability studies. That's done at a single point in time snapshot. Of course, you need to design your device to be compliant with those studies and with standards, but it isn't something that is a cyclical review process as much as cybersecurity. We want to make sure that cybersecurity is incorporated early into the product design, and then it is addressed often throughout the lifecycle. Once you have a device that has a proven market fit, you know that this is going to be a viable product. This is something that you have created in an MVP or a minimum viable product, sort of a prototype phase. This is where you want to start addressing cybersecurity. Going back to your requirements, understanding what does the product do, and then how is it going to do that securely. When we're following this throughout this life cycle approach, we're going to see products built with compliance and safety first. This is not only going to be beneficial towards you as the MedTech innovator, getting ready for the FDA approval process and breezing through the regulatory side of the submission, but it's also going to be very effective once you're out on the market, trying to interact with healthcare delivery organizations, gaining customer trust, making sure that you know you have a safe and secure product out on the market.
Yeah, I think it's important to hit on that MVP concept or your prototype. A lot of people say that maybe you should consider cybersecurity before your prototype or in the prototype, but if you don't have a market fit, from my perspective, there's no point in wasting money on cybersecurity until you've proven that your MVP has a market fit. And then when you actually start to design the real product, that's when you should consider cybersecurity. So you're not wasting time on things that are unnecessary.
Yep, exactly.
So the whole idea is we want to include cybersecurity early and often. It's a iterative process, as Trevor said, not a point in time process or a point in time study like biocompatibility or sterility, as Trevor mentioned. It needs to be iteratively considered throughout the entire development process. And some of the things that need to be considered are connectivity choices, as example, like what cloud provider are you going to use? And this is an early design decision. And these need to be decided on before you freeze the code, because then it's too late and we have to retrofit things and redesign things. We also have to look at what Wi-Fi type of connectivity we're going to have. Are we going to use Bluetooth low emissions? And if we are going to use Bluetooth low emissions, does our hardware support the type of Bluetooth we need, as an example? So it's not just software design considerations. It's actually what microcontrollers do we choose? What components do we choose that make up our product as well? We have to look at data flows and any PHI, protected health information as well. How are we going to make sure that is protected to the right degree of encryption? Like I mentioned about hardware components, it is extremely important to make sure you choose the right hardware components, because not every hardware component supports the cybersecurity requirements of the FDA or MDR or any other regulatory body. This is as simple as choosing the right microcontroller. One of our clients came to us a few years ago that had made a decision a couple years before they engaged with us to use a specific microcontroller for a bronchial decongestion system. The microcontroller they chose did not support secure boot. The FDA requires secure boot. So they had to strip away some of the functionalities for their initial 510K submission because it was too risky and opened up too many doors for lines of questioning from the FDA if they left those features in, because then the FDA was going to start asking about secure boot, as an example. And then you also have to look at the intended use when you're making these design decisions. Like, what environment is your product going to go into, and what requirements do they have? One of the things that we've noticed a lot of people overlook is they think the bar is the FDA, as an example, United States. Often the FDA is the minimum you should do, but the healthcare delivery organization or the ultimate client of the manufacturer may have more stringent requirements or additional requirements than the FDA. So it's good to reverse engineer which markets you're trying to get into, and specifically which healthcare delivery organizations you're trying to get into, and figure out what their requirements are, because they may exceed what the FDA's requirements are if it's in the United States, as an example.
I think even looking at some international markets outside of the US is really important before you're making some of these decisions. Understanding what different markets you want to access and how cybersecurity will be affected in those different markets. So, the easy example to give is always if you want to sell a product in international markets as well as China. China famously has very unique cybersecurity requirements that have to comply with Chinese cyber law, in addition to the NMPA guidelines. So, when we're looking at something such as a cloud hosting provider, certain cloud hosting providers are not going to work very well in China. So, just Google Cloud will not be effective at all. You're going to have to go back and try to redesign your product entirely from the ground up in Azure, or try to cobble together something with AWS instead of having a clear path forward from the get go. So, this is one thing that you should be aware of when you're trying to understand your product market fit, understand what markets you're going to access, and then what some of the downstream consequences could be from there if you choose to make certain connectivity decisions. Now, I think it's important to look at what are some of the differences when we have good versus late cybersecurity addressed within a medical device. We've talked a little bit about what we see as some of the early design decisions that can be helpful to make, some of the consequences of when we wait too long for cybersecurity. But what does that really mean in effect as someone building the product? When we're addressing cybersecurity early, if we're taking a look before we have any design freezes, we're still in an early stage, maybe we're even still building out our requirements, these are usually going to be minor modifications that we have to make. We don't have a finished product. We don't have to go back and strip anything away to try to add on new layers of security. We can build it through correctly the first time. A lot of these decisions are going to be a lot easier since it isn't going to come down to a massive cost benefit analysis of is it worth taking this much effort to try to peel back some functionality and make sure that the device is secure. We can go back to the example you were talking about earlier around a microcontroller with secure boot enabled. If we understand this is a requirement as we're designing the product, it's not going to be a very difficult decision to just get microcontrollers with secure boot. They might even be a little bit more expensive than some other ones, but it is a very easy decision to make at that point. If we have to go back and strip out all of these old microcontrollers that we've already purchased and try to get new ones into the devices, that is a massive, massive change. There's going to be a lot of last minute scrambling to try to get all the documentation in line with regulatory expectations, making sure that our quality system has complete coverage of everything that we've done to try to retrofit security on. And most importantly, and often the most detrimental, is going to be all of the testing that's going to come in. When we're going through cybersecurity testing, if we're building a device securely, the safe assumption is that we're going to see less problems and less risks come up during cybersecurity testing. If we have to go back and try to test a late security device, we're generally going to start unraveling more and more problems. It's a little bit like peeling back some of these layers and just seeing more and more coming out as we see that the device has not been built securely. So what we want to do is try to avoid this by shifting cybersecurity left in the process, making sure that we have security by design within our products, which is going to help streamline our path to market. We aren't going to have to go back and make any of these difficult decisions if we already made them while they were easy in the early stages, while we built out our functional product requirements to map down to our security requirements, instead of trying to retrofit them after the fact.
Yeah, I wanted to touch on something you said there, the last bullet, cybersecurity by design streamlines the path to market. I think there's a misconception that cybersecurity is going to cost more money, so people avoid doing it. But the fact of the matter is, if you do it early, it is more cost effective and will accelerate your time to market. Because as we talked about in like one of the first slides, if you wait to the very end, you're going to have to do a lot of redesign, a lot of rework, which delays your time to market and is actually going to cost you more. One of our services is design consulting for cybersecurity, so secure design consulting, and that generally costs around $5,000. And I often say you can spend $5,000 now and do this correctly, or spend $500,000 later in rework if you wait to the very end.
And we've seen delays and deficiencies go on for a very long time. We've seen for as long as 12 months with regulators pushing back once they have seen devices that were inherently built without security in mind. And so trying to step away from that long of a delay and make sure we're getting this right the first time, it's not only going to be a more effective, cleaner, and faster way to market, but it's going to provide a lot of confidence that you're doing things right. The FDA wants to see that you're giving your best effort to provide reasonable security in the system. As long as you're showing them that, they're going to be reasonable and they'll want to work with you. If they start poking holes in your submission, they're identifying problems left and right, they're going to have the suspicion that you aren't doing something correctly here, and they're going to keep pulling on that thread until they figure out exactly what that is.
Yeah, 12 months is a long delay.
Yeah.
So one of the considerations with cybersecurity and the design controls you have to look at is what are the user needs and what are the cybersecurity needs? And there's a couple distinctions here. Typically, when we're talking about user requirements to make the device work as intended, those are grouped into functional requirements. Like what is required to make the device function and do what we want it to do. But then we have the non-functional requirements, which are the cybersecurity requirements. They're not required for the device to function, but they're required for the device to be secure. And those need to be designed into the product. And this is a little bit of a challenge because people typically think in terms of what I need to do to make my product functional, and that's it. But we also have to think in terms of what I need to do to make my product functional and make it secure, because just as if it may function wrong or a function may not operate properly, that could harm a patient or kill a patient. The same thing applies to cybersecurity. If somebody can hack into the device and take it offline, and it's an in vitro diagnostic device used to detect sepsis, that could harm a patient or kill a patient as well. So these non-functional cybersecurity requirements really need to be looked at early on and then designed into the product because they affect patient safety. And that's a misconception that we see quite a bit. A lot of people think cybersecurity is just about data protection. Its primary focus is patient safety. So our architecture, as Trevor talked about a little bit, if we reverse engineer the market we want to go to, that can drive our architecture design decisions. As Trevor pointed out with China, if we plan to sell to China, we probably don't want to use Google as our cloud provider. Because then later on, after we if we get cleared in the United States and we try to go to China, now we're going to have to redesign our product to a different cloud provider. Whereas if we would have looked at where we want to go and reverse engineer which markets we want to get into, we could have made the right decisions early on. And also when we make those proper design decisions, it is easier to do labeling, because one of the pushes now is for labeling of what cybersecurity controls have been put in place. So the user of your device, which could be a consumer if it's sold to a consumer directly, or it could be a healthcare delivery organization, they have the right to read the label and say, I don't want to accept the risk of this device, or I will accept the risk, because the labeling should disclose the things like what type of encryption you use, what your software bill of materials includes. And the whole idea is so the user of your device can make an informed decision based on that risk, because ultimately they are accepting the risk of your device when they put it in their environment.
Going back to your point on requirements, one easy way to remember how the different types of requirements can tie in that I always think back to is the functional requirements are what your product does, and the non-functional requirements are how it does it. So an example to think of is, we'll say a functional requirement of your product is that you have an imaging system and you have to log into the imaging system. The non-functional security requirements are how you're logging into the image system. You might need to have a password with 12 characters. You might need to have a one-time pass on your phone or get a code sent to your email, something like that. So it's not affecting what happens, but it's affecting how it works on the back end.
That's a good example.
All right. One thing that's very important when we're looking through certain cybersecurity concerns is the quality system as well. So the quality system is going to be essentially your history of documentation within your product. It's going to describe what your product is, how you're managing certain processes, and it's going to prove that you're building a safe and reproducible and quality product. When we're fixing vulnerabilities, when we're identifying problems, or when we're even just releasing general patches, it's really important to understand exactly what these changes entail. What parts of the code are we modifying? Are we making any hardware changes? How are we documenting that? What is the source of this change and what is the outcome? All of these are very important questions to ask yourself when you're making any modifications to the product. Now, it's especially important when we're looking at a vulnerability that's come up in the system. We're assuming this vulnerability has some input, it's been discovered through testing, discovered through a risk analysis or a threat modeling exercise, whatever it might be. But we identified that there is a risk in the system. We had to make some change to remove that risk. We need to have all of this clean traceability going through from the identification all the way down to the verification that the risk remediation was sufficient. It's going to be really important as well at this phase to make sure that we have very strong supplier controls in place. This is something very important, and I would say is likely one of the more significant and more common deficiencies that we identify when we're reviewing cybersecurity maturity and capacity, is having a clean process to vet different components coming in to your product. Now, this is a lot easier said than done. When we look at a typical software bill of materials for just about any software as a medical device with web technologies, it's not uncommon to see hundreds, if not thousands, of components making their way into the system. Stepping back and doing a review of every single one of those components, understanding exactly how it's maintained, who's maintaining it, for how long it's being maintained, is a very difficult task. We can't just say, oh, well, it's easy to see that. It's right on the page for the component. As with well over 99% of open source components, this information is not going to be available. What we can try to do as the manufacturer is make sure that we are choosing supplier components that already have some of these quality considerations in place. We aren't going to just bring in any random component that we find on the internet. We're going to make sure we're using components with a published end of life date, with a known support process, with a known process for remediating vulnerabilities. This is going to be a little bit more common if we're using larger scale products or very big systems such as operating systems, such as Windows or Linux or even Mac OS, or if we're using very common frameworks such as React, which is going to have a little bit more maturity behind it. So this isn't necessarily going to be an easy way to go through this process, but it's very important to at least have these considerations in mind so you can identify potentially vulnerable components. We also want to make sure that we have a very strong process to handle complaints and support cybersecurity with our CAPA procedures. So CAPA being our corrective and preventative actions. If we are identifying risks or if our users are identifying risks in the system, what are we doing about it? How are we taking in this information and how are we responding? It's a requirement laid out by the FDA and by other regulators that we need to have a process for intaking vulnerabilities if a user or if a patient identifies a potential security risk in the system. What happens from there? We can collect all this information all day, but it doesn't matter if we don't have actionable steps to take with that information. So we want to be sure that there's a clean process to document and capture any vulnerabilities that are coming in from users, explain how we're going to fix it, adhere to any timelines based on severity, and then verify that everything has been properly fixed. Now, as I've been talking through some of these points, I've said verify, traceability, seeing it through, different things like that multiple different times. And ultimately, what I'm trying to get at here is that traceability is the most important thing in this process. We need to have a clear mapping from the input to any of our decisions as well as the outcome from that decision. We need to make sure that we have all of these different steps documented together so that regulators can see the story that we're trying to present of how we've identified and fixed these problems. If we don't have a clear connection between everything, the narrative that we're portraying towards the regulators becomes murky. When we're getting ready for these submissions into the FDA, it can be hard for them to understand, how did your threat modeling feed into your penetration testing? How did that feed into your risk assessment? How did your risk assessment feed into your labeling, into your risk management report? And if we have clean traceability tying all these different steps together, it's very easy for the FDA to see step one all the way down until the very end without needing any questions on exactly how you're stringing everything together here.
I think a good distinction here, you kind of alluded to it, is we're talking about the entire total product lifecycle. When you're talking about complaint handling and CAPA, that is post-market. So we got the pre-market portion of what we need to do, but we also have the post-market. And from a design perspective, even when you're designing your post-market strategy, it needs to include these things the way that traceability, as Trevor's alluding to. So we're looking at cybersecurity through the entire life cycle.
Yeah, I think that's an excellent point. This isn't something that you can do just as you're designing the product. It needs to carry through all the way down. So even with vulnerabilities that you're identifying in the early stages of the product, they might have a little bit of a different process for identifying them later on. Some of the factors with even how they're identified can change. For an example, one factor that can come up with post-market vulnerabilities that's not going to be present in pre-market vulnerabilities would be reporting confidence or exploit maturity, where you're understanding exactly how verifiable and how true is the information that you're getting in from a third-party resource, where when you're doing this during the pre-market phases, you're likely going to be collecting everything yourself. So it's a little bit of a different lens that we're looking at it, but it needs to carry through all the way down.
Yeah, and one more thing I want to add there, because I was just on a call with a prospect yesterday talking about this exact concept, is we've been talking a lot about designing the product with cybersecurity in mind. The prospect yesterday wants to do over-the-air updates, or OTA. So in addition to the product design, they have to design their update infrastructure securely as well, because that's ultimately part of how the product is going to be updated once it's on the market.
Yep. Yeah, it's a great point to make sure that you have cybersecurity covered through all components in your system. It's something we see all the time where a certain component will be missed from the system. Maybe it's an update server, a companion application, whatever it might be, but we want to make sure we have this total coverage.
So to tie all this together, the FDA and other regulatory bodies, they want to see evidence and artifacts and traceability that you've done your due diligence with cybersecurity, that you practice good cyber hygiene, as they like to say. I'm not a big fan of that term, but I understand that's a common term used in the industry. So that includes things like cybersecurity testing. This is not just penetration testing, that's part of it. But did you get penetration testing done by a firm that understands pen testing in MedTech specifically? Because the MedTech industry is a highly regulated industry. It's different than traditional cybersecurity. Did you do fuzz testing? Did you do static application security testing, dynamic application security testing? Did you do software bill of materials? So there's all these components that are required. Do you have the proper documentation as evidence as well? And that needs to go in your quality management system, as Trevor was talking about. We need the traceability from everything. The traceability that shows, here's our threat model, here's the test that validated the threat that was mitigated, and here's the evidence of all that. And then the evidence can be the design itself. Like, we verified this design actually worked from a cybersecurity perspective. And then what are our supplier controls? Since we're looking at that software bill of materials, all the third-party components we borrowed to create our product, through that traceability of that lineage, how do we know that version 1.3 of this authentication module is secure? We have to be able to prove that as well, through that software bill of materials and analysis of the software bill of materials. And ideally, if someone has done the proper design, they started out early and they've done the proper cybersecurity design, the right point in time to start doing all of these activities for a pre-market submission is typically around 4 to 6 months before the submission. Because even if you designed everything properly, the design may have taken place several years ago and things have changed. So from a cybersecurity perspective, we may still find things that need to be updated. On average, what I heard is it takes a MedTech innovator 7 years and $35 million to bring a product to market. So if you started 7 years ago and you're 6 months out from a submission, that's been 6.5 months, that things probably have changed. So that's why you want to give yourself enough leeway to make some corrections.
I also want to tie in another point around why this 4 to 6 month window is ideal and make sure that we aren't constructing all of this documentation. We aren't trying to string it all together 6 months out. It should be an artifact of building it safely by design throughout the full life cycle, but this is where we want to start preparing this. Now, why it's important to have about this window instead of preparing it, say, 12 months, 18 months, 24 months out, is that we need to have a level of recency within our cybersecurity testing. That's one very common kickback that we see from the FDA is your cybersecurity testing was not done recently enough. Generally, the rule of thumb is that testing is valid for 12 months. However, in some cases, we have seen 6 months as sort of the rule of thumb to follow. We try to take a little bit more of a risk averse approach to doing this, which is why we recommend 6 months as the maximum you should be out from your submission. Now, if we're doing it too close to the submission, let's say we're doing it 1 to 2 months out, even if we have all of the artifacts compiled, there can always be surprises that come up. If we identify a critical vulnerability during our penetration testing a month out from submission, that submission date's likely going to have to get pushed back a little bit. If we identify it around 5 or 6 months out from submission, that's going to be plenty of time to make any design changes that we need to do to make sure we have a secure product. All right. I wanted to talk a little bit about some of the warning signs that you might be a little bit late on your cybersecurity. And then we'll go ahead and dive into some of the quick wins that you can get to get back on track if you're seeing some of these warning signs show up. I just was talking about how testing at the last minute is going to be a bit of a sign that there might be some problems coming up. And this is the number one thing that we identify as a warning sign. Penetration testing and cybersecurity testing is meant to be a cyclical process. It's not something that's one and done as a point in time study. We want to see it throughout the life cycle as we're making major design shifts throughout the product. Of course, the final penetration testing that's going to go forward to the regulators, that's likely going to be considered the most valid and the most accurate testing since it's done on the most complete version of the product. But doing it too late is going to leave the risk for vulnerabilities coming up that aren't going to be super easy to fix. Another warning sign that you might be getting a little bit too far without cybersecurity is getting close towards a submission phase without a software bill of materials or without a clear inventory of your software of unknown provenance or pedigree. We hear those interchangeably, but not knowing exactly what goes into your product. This is going all the way back to some of these supplier controls. How are you vetting what different components you're going to allow in your system? And how are you making sure that you're tracking these carefully and that you know these are safe? If you're doing this exercise at the last minute, I'm sure you might remember me saying earlier that it's common to see hundreds, if not thousands of components show up in a software bill of materials. And if you don't know exactly what those are until the last minute, the odds are pretty significant that you're going to come back with a lot of vulnerabilities. Another common problem that we'll see is that getting towards the end, we'll have our functional product requirements. We might even have our non-functional requirements around it, but we don't have dedicated, documented security requirements. It's very important to break this out as a separate thread so that we can trace it all the way back into some of these cybersecurity controls. Remember, we're leaning into traceability as king here. We want to see traceability between the requirements down to the decisions that we've made to implement cybersecurity controls. If we can't tell that story, it's no longer clear to the regulators exactly why we're designing the device the way that we do. Another common thing that can come up is that our risk file is missing cybersecurity threats. You may cover safety risk, you may cover financial, business risk, but if we aren't explicitly addressing cybersecurity risk as a separate, distinct process, that is going to be cause for the regulators to push back. Finally, one problem that we might see as well is that design is frozen, but controls are missing. We've frozen the product. We say this is good enough. We're going to freeze the code. We aren't making any more changes, but we don't have dedicated and explicitly called out cybersecurity controls. We may even have these controls actually built into the system, but if they're not clearly described and clearly documented, there isn't that evidence that we can put forward to the regulators to provide assurance that we've done our due diligence with cybersecurity.
So one of the things to recover on a tight timeline in the next 2 to 4 weeks to consider is identify the highest risk exposure points. So we always want to go by risk. We want to prioritize things by risk because we can't do everything all at once. So it makes sense to have a risk-based approach and figure out what we need to start working on today, and then what we can work on tomorrow, and what we can work on the next week from a risk-based approach. And this depends on your product, obviously. But the whole idea is we can look at remote access. That's a big vulnerability if somebody can remotely access your device versus they have to have physical access. Where the data flows, are those secure? Are we doing encryption? Are we doing integrity of the data? How are we handling authentication if that's on your device? Is it multi-factor authentication, for instance? And how are we handling encryption for data at rest, data in transit? Are we following the latest standards that are approved? And then we need the evidence to support our mitigation steps. Like, what were the requirements? What risk assessment did we do? What testing did we do to validate this? And Trevor's been talking about this. We've been talking about this throughout. We need that traceability. As I think Trevor said, traceability is king. We need traceability that shows here's the risk, here's what we did to mitigate it, here's what we did to validate it, and here's the evidence that supports that line there, that traceability.
I think one important thing is when you're seeing some of those warning signs, the time to fix your cybersecurity is now. Waiting any longer is when you're going to start to see more of these problems come up. It's a little bit of a snowball effect when you leave some of these to the last minute. They're going to start building. You're going to identify more and more problems in your risk assessment, and you want to try to get ahead of it as quickly as possible. All right, now we've been talking about the total product lifecycle, and that is going to include the post-market considerations. We've talked a little bit about some of the continuous vulnerability monitoring in the system. Part of this being through our CAPA procedure, our coordinated vulnerability disclosure, through ongoing testing, whatever that might be, to make sure that we're identifying any risks coming into the system. Remember, this is not a point-in-time snapshot. It needs to be an ongoing cyclical process throughout the life cycle of the product. It's also an expectation and a strong push from regulators for devices to receive patches while they're out in the field. While it's not explicitly required, it is very helpful and provides assurance to the regulators that you'll be able to fix problems as they come up. Now, through any information that we're collecting, be this through our CAPA, be this through maybe third-party research, or through notifications from the FDA, CISA, we want to make sure that we're collecting all of this feedback, integrating it into the risk file, and having a clear process on how are we actually responding to threats that come up in the post-market. How are we using this information we're collecting to provide a better version of the device in the future? We want to make sure that we're using post-market cybersecurity management to ensure that we have ongoing patient safety and that the security of the device does not start slipping once it's out on the market.
That's right. Cybersecurity needs to be considered from design to disposal.
All the way through. All right.
So we have a couple of case studies here from our experience. I can start on this one, Trevor. So this one was a U.S. startup that focused on HIPAA, which is protecting health information, but they ignored patient safety. And this is a common problem we see. I kind of alluded to this earlier, that with medical devices, the data is important in protecting sensitive data, but the primary focus is patient safety. If somebody can hack into a medical device, what harm can they cause to the patient? So that's the lens we look at risk through. We also look at protecting the data, but imagine if you have a pacemaker and you're being shocked to death because someone can wirelessly connect to it, while at the same time someone's stealing your protected health information. Which one is priority, right? Probably being shocked to death. So this organization, they focus on HIPAA, which you see quite a bit. So they didn't address the patient safety risk. So once we worked with them, we got them to look at the lens like, okay, what is the impact to patient safety? And they implemented a secure product development framework. So they went through and looked at the lens of their product and implemented a secure way of focusing on what is the impact to patient, what's the risk, and they finally got FDA cleared, and their investor confidence was restored as well. And I have a question that came in here. I'll go ahead and throw it on the screen here, Trevor. Maybe you can address this question.
How do you deal with SBOM for an embedded seat with custom code and snippets of code from the public using Renesas SFB? So
very specific question here.
Very specific question, but there is a very specific answer for it. And that is that Unfortunately, there is no silver bullet right now for generating SBOMs out of embedded C code, low-level languages, C and C++. There are quite a few tools out on the market that do their best attempt at it. FOSSA can be pretty successful at it. RunSafe can do a pretty good job at generating SBOMs out of C code as well. But ultimately, what they're all trying to do is take a look at the code and see how similar it is to code that's out on the internet, or code that's in certain repositories, to say, well, this is about a 99% match, so we're going to figure that it is this bit of source code. Now, of course, that's not going to be a perfect process. And so ultimately, what we like to see is that you do a first pass generating it through a analysis of the source code using an automated tool to generate that SBOM, and then deconflict that with what you would expect to see in the system. Going back a little bit further, if you aren't sure what to expect to see in the system, this will go back to some of our supplier controls that we've talked about. You don't want to start integrating things without knowing exactly what they're doing, especially with low-level languages where it can be very difficult to trace them down on the back end. So the long story short of it is essentially do a first cut using any one of your chosen tools to generate the SBOM, deconflict that against what you would expect to see, and then you can go in, add anything manually, or remove anything manually that you would not expect to be in place.
All right. I like the answer. Let's go to case study number 2.
All right. Now, this is a case study that I can speak a little bit to. So we had a problem with a client that we were working with. They had a deficiency come back from the FDA, and they pushed it down. It was sort of a moving goalpost situation until there were 72 hours left to respond to the FDA. Now, throughout
That's not
this
a lot of
process,
time.
it's not a lot of time.
It
Luckily,
causes a
throughout
lot of
this
stress
process,
too, doesn't it?
exactly. It was a lot of stress for the MedTech innovator, a lot of stress for our team to make sure that we were able to get it done. But the good news about this was that the controls were in place. The testing had been performed. All of this was covered. It just wasn't documented correctly. So we needed to make sure to string together all of this information and build out this traceability in a race against the clock within 72 hours. Now, we were able to do it. It was a little bit of a buzzer beater situation, but we got in right under the wire and were able to submit within 72 hours to the FDA, where we shortly after received a clearance notification. Now, while this worked, this is not a story that we should try to repeat. Having this short of a timeline was very lucky that things went well for us. We were able to identify that we already had all these controls in place. We'd luckily been working on the device for quite some time to make sure that this was built securely. And so we were able to easily document everything. If we had started this process and identified that there were critical controls missing, there were certain types of testing missing, there's no chance you can get through this in 72 hours. So this is a little bit of a cautionary tale on what can happen when we're waiting too long.
This one is very common. We see this quite a bit. And this is where early on, when you're designing your product, I think it's important to understand if it meets the requirements of a cyber device. And in the United States, the FDA clarified this in 2025, the middle of 2025, what is a cyber device. Basically, it has software and any way to connect to the device. When I say any way, it's a little bit ambiguous. This is what the FDA clarified. If it has NFC, RFID, BLE, Bluetooth low emission, USB, Wi-Fi, any type of connectivity, that makes it a cyber device. A lot of people think, well, I've got a USB port and it's only used for maintenance. If that USB port is exposed, then your device is a cyber device. And the challenge is, if you don't think your device is a cyber device, but the FDA does, now you have to go back and do all the cybersecurity requirements that you didn't design into the device because you didn't think it was a cyber device to begin with. So it's very important when you're developing a device, a product, to ask yourself the question and look at the guidance: does my device meet the requirements to be a cyber device? And if it does, all the things we're talking about, the design controls, the cybersecurity requirements, need to be put into that device. So you have a body of evidence that you started building along the way versus waiting to the rejection from the FDA where they say, well, you didn't do anything cybersecurity related and this is an actual cyber device.
All right. Well, we covered a lot of ground here. We talked about a lot of very important things, and then we showcased some of the examples of what can really happen when we're not addressing these. I want to talk about some of the main ideas that we should take away from this. And the first and most important being that early cybersecurity is strong cybersecurity. We don't want to try to leave things to the last minute. And this is going to tie us right into our second point, where leaving cybersecurity to the last minute is what can trigger FDA scrutiny, delays in your submission, and then problems going through into a cleared product with your go-to-market strategy. We want to see cybersecurity treated as a total product lifecycle consideration, addressed from the very earliest stages all the way through down to disposal of the product. To provide evidence of this, we need to make sure that we have strong quality processes and strong controls in place that are going to provide that regulatory confidence and make sure that we're going through with our FDA submissions with no problems and no delays.
We'll stick around if anyone has any questions for a couple more minutes. But thanks for tuning in to our webinar. We'll be having one next month. We try to do one of these every month. Well, we do one every month. And if you'd like to reach out to us, here's our contact information, bluegoatcyber.com. There's our QR code. We're happy to jump on a call for no cost and do a gap analysis and see how we can help or just give you some guidance. We got a fan of our takeaways. Awesome.
Well, it's important to make sure that you're taking away something from this. Otherwise, it's just us talking for fun.
Well, a lot of people think knowledge is power. I'm not a big fan of that phrase. I think unless you can do something with the knowledge, it doesn't matter.
Applied knowledge is power.
Yeah. It's like you can have the awareness all day, but until you make it actionable, it doesn't matter. All right, we'll go ahead and end here. Thanks again for tuning in. We hope you found this webinar valuable, and we hope to see you on the next one.
See you next month.
Have a great day.